Hey guys, Jon with Wall Street Sports Series. I'm a good man, Nick Nelson.
Hello, John. Good
How
to
are
see you again.
You too.
Yeah.
You too. Cairo,
Yeah.
one of the best.
Who?
You.
Me? I'm not allowed to say such things, my man. That's up to others to decide.
That's true. That's true.
Yeah. I am passionate about it. I'll say that.
Good.
Chiro is something that, has changed my life. It's changed a lot of people's lives. So I'm stoked to be a chiropractor, and I'm happy with everyone I get to help. But there's a lot of flavors out there, and every flavor is a little different for each person. So, it'll always change with their perception. But I like to go with the idea that your vibe attracts your tribe. So the people that resonate, they resonate, and they, would probably not want to go anywhere else. And some people would probably choose anywhere else. So it all depends. Yeah.
That's a good segue actually, because Cairo, I found, okay, let's take massage. Massage is very simple. Oh, I'm gonna move the muscles, massage the muscles, wherever it is, right? So people can really know what to expect when they say, I'm gonna go get a massage.
Yeah, that's true.
Cairo, there is such a vast style, changes, differences between one practitioner to another. So maybe to kind of talk about what chiropractic is in general, and then go into the different specificities, because the way that you treat it is much different than another chiro would treat.
Sure, yeah. So chiropractic itself, it started like any other science would. It started with an idea and a theory, and then that theory was tested, and then that test resulted in a positive response, and then that test has been repeated millions of times every single year since. So the original test was in 1895. And there was an idea that was placed on an individual that had training in anatomy and understood how the body works. And somebody had told them that they fell and they landed on their head 17 years prior, and they heard a pop in their neck, and they could no longer hear out of one ear, and they had not heard out of that ear ever since. Given the history and given the understanding of the body, the theory was, well, if something popped and made you not hear, if we pop that back into place, maybe you can hear again.
Oh, yeah.
The experiment happened the next day. The individual had that bone moved back into the neck, and then that individual restored their hearing. So
interesting.
That was the first and one, only time in recorded history that we know of where something like that had happened and the result had equaled that. So then the growing theory from there was simply an understanding that if there is disruption to the nervous system, this is what causes all forms of disease and dysfunction in the body.
Oh.
So any type of dysfunction in the body can be or could be related back to dysfunction in the nervous system.
And what is a nervous system?
The nervous system is the brain and the spinal nerves and the cranial nerves and all of the peripheral nerves outside of there.
Okay.
So that is what a textbook would include in the category of the nervous system. It includes branches like the autonomic nervous system, which is your sympathetic and parasympathetic. This is your fight or flight response and your rest and digest response. It includes other big segue pathways of things like the vagus nerve that has a big effect on all of your internal organ function, all of your stress responses. So the nervous system is a broad spectrum name for basically the entire governing system of your body.
Okay.
So it sounds very basic when a chiropractor were to say that disruption in the nervous system could and will equal disruption in function and disease. However, what they're actually saying is that any change to the regulator of the body, whether that be toxin-induced or mechanically induced or thought-based induced, those things will disrupt communication, and that communication, when disrupted long enough, will lead to dysfunction. And if dysfunction stays long enough, it will lead to disease. So this is the pathway that was honed out through chiropractic philosophy and assessment. And this was done very long time ago, early in the 1900s. And since it's continued to be proven day after day in many offices like my own around the world. And that is the premise of what chiropractic is. So it's a scientific field where we use a theory that has proof behind that and continues to be proven correct. And we use that on a vast amount of situations and applications of people, and we get positive results from there.
Interesting.
Yeah, that's the basics. Now, when it comes to the different flavors, this is where, it's a very large, grandiose field that we're working on. And Some of the I guess people that have had negative things to say about chiropractic have looked at our claims and our statements and said that they are too grandiose and that we're talking about too much of the body to be able to have an impact on. And so based on those complaints or people pushing against what we're doing, each individual chiropractor that gets trained in the philosophy, the art, and the science of chiropractic, they tend to find different areas of the pursuit of that large field that they tend to focus on and they have a big connection to. So some may, really want to work with athletes, and so their only perception or only focus becomes performance of an athlete. And when it comes to performance of an athlete, we all know that there are more things than just the nervous system that needs to be corrected and regulated. Sometimes people sprain an elbow or they get tennis elbow, they, blow their Achilles tendon. So some chiropractors really push towards the soft tissue rehabilitation side of things. They integrate that. We as chiropractors, I can get my ticket to do acupuncture. I can do Graston. I can do soft tissue. All of the modalities that blend different styles of practices like physiotherapy and massage. We have the ability to do that under our license. It all depends on if you want to or not.
I see.
So the other chiropractor that may be in the exact same classroom as that first may realize that they have a big propensity towards neurological conditions in their family, in their friend group, or in their life. They may have experienced some sort of neurological trauma. They may have experienced people that have neurological deficits. And so for them, their field of influence wants to be more in the side of neurological deficits.
Right.
So they can spend a lot more time learning cranial nerves. They can spend a lot more time working with individuals of that category and become more honed in on working with the neurological effects of chiropractic. So it does really come down to each individual practitioner. There are influences in terms of, what field of thought you grew up in terms of your training. So some schools have different teachings, some places around the world, including, Canada versus California, where I was trained. There is very different, I guess, political pushes in terms of what style of practice they prefer and they want the general populace to practice.
Really? Well,
yeah.
What are those differences? California here.
California has a lot more open concept of holistic healing.
Okay.
So there is a lot more of a openness, not only from the public, but from the regulating bodies to be, I guess, open and accepting of ideas that sound a little bit more energetic, that sound a bit more holistic in their approach. So, in Canada, we have a very mechanistic model of Western medicine that is engrossed all of Alberta, all of Canada, in not just chiropractic, but all of the alternative modalities are influenced by that very mechanistic pathway. People in California and other places in the States, they have a little bit different perceptions of things. They're a bit more open to alternative Eastern philosophies, alternative healings that are not, pushed in the mainstream media sources.
Really?
Yeah. So
Interesting.
you have an ability to practice things in California and speak about things in California with a bit more openness than you do here. And it's not perfect by any way. In Alberta specifically, where we are, we have a growing list of conditions that we are not allowed to discuss the relationship between the nervous system and those conditions, and therefore not able to discuss the relationship of chiropractic to those conditions. And so there's it's a fine tuning of what they would prefer chiropractors to focus on. And this comes down to, differences in the way we all practice, but in all forms of, whether it's religion, whether it's politics, there becomes one group that is at the top that has favorable ideas in one direction and favorable ideas in another. And they begin to influence and push their influence on others.
Sure.
So currently the place that we are in is a place where there's a strong desire for chiropractors to make use of the fact that in Alberta and Canada, we are primary care physicians, and
Okay.
they want us to expand into the classical physician role of prescribing medications, prescribing painkillers,
Oh,
and
interesting.
working on musculoskeletal issues as opposed to traditional chiropractic philosophies, beliefs, and practices.
Interesting.
Mm-hmm.
Very interesting. So almost like to help alleviate the, you could say, overload of the healthcare system, if they want you to be more mechanistic in nature and more doctor-esque in nature.
Correct.
Huh.
Yeah.
Interesting.
Yeah, so you can see this going into other schools as well. So, when you're in a medical school, you have the white coat ceremony, which is the big ceremony in front of the school when you move into the clinical side of your
Oh, yeah. Okay.
your training.
Mhm.
And many chiropractic schools have adopted the white coat ceremony as well. And those chiropractors are trained with a white coat. They're trained, with the same stethoscope around the neck. And though
No way.
we're trained in the same things. I have the stethoscope. I still have the otoscope. I have all of this gear.
Mhm.
The difference is the way in which we're taught to apply it. These are tools that we need when we need them. And, we use them very rarely. I think I check people's blood pressure often, but outside of that, these tools are, once every 5-10 years, you might pull one of these things out. But if we were to pursue the medical side of things and push towards allopathic style training, we would look a lot more like going into your general primary care physician, where you would walk in and you would have a lot of those same tools on the table, those same assessment techniques. And the thing is that there is a place for that. Absolutely. And we need that for when we need it. The difference for me in the way I see things is that we are trained in something very different than that nobody else in the world can or does do.
Really?
And that's where our strength should be, or that's where my strength is at least placed, is the effort to do something that nobody else is doing in the healthcare field, and do it very well. Because a lot of people are looking for something different from when they go to their medical doctor and have that experience in their appointments. A lot of people are looking for a different experience. So I think that is where we can thrive, and where, especially at this time in the world where things have changed a lot in the last 5 years, people are more open now to holistic alternative theories and practices.
Totally. Big time.
Yeah.
Touch on we are doing things that no one else is doing, because that's very interesting. Because typically chiro, physio, acupuncture, massage are always kind of lumped into one group. And it's just like, crap, I can't get to my massage therapist, I'll go to my physio. Or I can't go to that, I'll go to acupuncture. So they seem to be interchangeable the way that they're presented, because they're all always clumped together, especially if you view it from a insurance standpoint. They're always together. So tell me what chiro is doing that's totally different than anyone else.
What chiro does that's totally different is the intent of the adjustment. So when you are in certain chiropractic offices that do tend to blend things a bit more and work with soft tissue and work with more physiotherapy style modalities, it may be difficult to see a difference, because in the end, there really is a blending of techniques in those paradigms. Traditional chiropractic, it was situated as a distinct profession and a distinct medical profession in the early, I believe, 1930s was when the court case happened. Because originally, when chiropractic was invented, the individuals that were trained and practicing chiropractic, they were actually being jailed for practicing medicine without a license.
I see.
So the original attack on chiropractic, or I guess attempt to bring it to its knees and not bring it to the public, was the arresting of individuals for practicing medicine.
Oh, wow.
So there was a very clear delineation made inside of a courtroom that showed that the difference between chiropractic and any other modality, including osteopathy, was that we had a focus on the understanding and the belief that we were adjusting the spine to affect the nervous system.
Okay.
So this is the underlying, still to this day, difference from all other. You can go to massage therapists, and some massage therapists will try and do manipulations. osteopaths and physiotherapists are also doing manipulations.
Yep.
The
Slow velocity, right?
Yes.
Low
Yeah,
velocity?
lower velocity than the chiropractic ones, which are, in that realm, they're titled HVLA, which is high velocity, low amplitude.
Okay.
So the difference with a osteopath and with a physiotherapist that learns techniques of manipulation is that their intention of doing so is simply to move joints and create mobility in a joint.
Yep. I see.
So even the term manipulation is very different in the chiropractic realm. We don't use that term. We use adjustment because manipulation has a fairly negative connotation in our perception.
That makes sense. Yeah.
Adjusting it's more fine tuning. The machine is working well, but you're always adjusting things to make it work better. So we are adjusting the spine and we're adjusting the joints to affect the nervous system and to affect the global function of the body.
Okay.
So even if, you were to walk into an office and you went into a physiotherapist's office and they did a manipulation, and you went into a chiropractic's office and they did an adjustment, if you're not trained in the background of both or, highly trained in anatomy and understanding what and why they're doing it, you'll hear a pop in one, you'll hear a pop in the other, and you think it's the same.
Totally.
So this is the, I guess, global reason why things get lumped together is that there is lack of understanding of the differences. And more lack of education to the public as to the differences. And that lack of education, that is something that's also part of, many, many years of an attempt to minimize chiropractic's effect on the world and try and make it so that we don't have the reach that we can. And we still see medical doctors, we still see media. I was watching Brooklyn Nine-Nine the other day and love that show. I got through the whole series. And then one of the episodes in the very last series, of course, they had to bring up chiropractic and laugh about it and laugh about the fact that chiropractors call themselves doctors and nobody respects them, blah, blah, blah. This is very common when it comes to media.
Very common.
Yeah.
I remember years ago, a chiro calling himself a doctor. He's a fake. He's a fraud.
Yeah.
I remember that a lot.
Yeah. I see it all the time. It's in, Family Guy. It's in American Dad. It's in, every, I think, Modern Family, 2.5 Men. One of the main characters is a chiropractor and he's about the most, imbecile of anybody that could ever exist. And that's on purpose. Yep. These things are done on purpose because despite us being helpful, we are hurtful to people that sell drugs and to people that sell medicine or surgeries and all those things. So there's a persistent effort to try and disregard what we do and try and scare people out of coming to us and make us look like fools. So this is something that we have to work around. And one of the big problems with that is that most of the information about chiropractic that reaches the general population is incorrect. And most of it is slanted in a direction that makes them not understand what we're doing, not have any reason to see value in what we're doing, and not be able to differentiate us from the other groups because it's favorable for the individuals that oppose chiropractic for you to go to physiotherapy instead or to massage instead, because you're going to get somebody that is applying a technique that may in some ways seem similar, but doesn't have the effects that a chiropractic adjustment does because the intention behind it is different and the process behind it is different.
Okay.
So it's favorable for other people and for the public to see us all as the same, because when 3 or 4 people offer, quote unquote, the same service, but only one group of that 3 or 4 people has been consistently degraded in the public and in music and in movies and stuff, and in your subconscious mind, you remember that, then that means that if you have 4 groups to choose from or 3 groups to choose from, you're going to choose one of the others that you don't have a negative connotation based around.
Absolutely.
Yeah.
And right now, I know we talked about this in the last one, but you're going to give me a stroke is the biggest one, right? Because people fear that whenever there's adjustments on their neck, oh man, you're going to release something or move something and they're going to die. Yeah. So talk about that.
Yeah, I mean, this is a frustrating one. I'm not going to lie. It's one that is persistent, and it's not because it's true. It's persistent because they continuously push stories in the media about it.
Yep.
And the hard thing is that our you know, chiropractic entities that are designed to protect and push chiropractic, there's a lot of, I find, focus on trying so hard to get us into favorable positions with medicine that there is not a stance that they're willing to stand, you know, strongly and firmly publicly against the medical model that is pushing that theory, because it's going to ruffle feathers, and they're desperately trying to have a good relationship with that group. So strokes and chiropractic are not related. And there is a vertebral artery that runs through the vertebra inside of the neck. And this is the one and only kind of stroke that has ever been, you know, said to be associated with chiropractic. So a lot of individuals think any stroke and in the brain, this is, you know, chiropractic related. And that's not true. It's a specific type that is consistently talked about called vertebral artery dissection. And this is because the anatomy allows artery to run through the vertebra of the neck. Now, this vertebra or this artery is very comfortable in that position. And every time you turn your head side to side, full range of motion of your neck, you're sliding that artery back and forth through those areas every single day. This is the way it's designed. That's its purpose, its place, and it's there for a reason, for protection. When we adjust somebody's neck, we turn the head side to side. So there has been a very easy, you know, low-hanging fruit attempt to associate when somebody has any sort of stroke or tear to that artery. The medical and the media tend to team up and pry into whether or not they have been to a chiropractor any time in the recent history. So with the growing rate of people that go to chiropractors, we have higher and higher likelihood that if somebody were to suffer one of those dissections, they had been to a chiropractor sometime in the recent history.
I see.
So this becomes a very easy place to pin. Now, the problem with this story and the problem with how media works is that they take this story and put it into the headlines, regardless if it's true or not, as soon as they can. But as soon as that story is investigated and they've shown that there is no actual relationship between those two, and that that person did not receive that vertebral artery dissection from a chiropractic adjustment, media doesn't want any part in that story.
No, of course.
That is the part of the stories that is let, you know, go to the crickets. Nobody hears about it. So in the early 1900s down to 1987 was when the court case happened with the American Medical Association. The rumor that we cause strokes in individuals and that we paralyze people and that we are quacks and not real doctors, those literal terms were part of a very global smear campaign on chiropractic. And I think we've all seen over the last 5 years that if something is opposed to the mainstream cycle of media, it's very easy to have stories come up that, true or not, are in everybody's front lines.
Oh, sure.
So during that time, for roughly 70 years, there was stories that were released to the public through papers and through all of these different mediums. They were taught into medical schools to all of the new upcoming doctors. These were very, very smart and insidious ways to attack chiropractic through its reputation.
Interesting.
And so this was something that went on for so long that everybody still to this day, yesterday in my clinic example, I had an individual that was a new patient that was older. She was about 55 years old. And after we adjusted her neck and we went through the whole x-ray process and showed her what we needed to do, she sat up and she was really excited, but also, you know, very surprised at the fact that she said, you know, I actually thought you were going to kill me. I thought I was going to have a stroke because that's, I know a friend of a friend and their cousin got a stroke from a chiropractor one time. And this is how the story always works. It's, you know, somebody knows somebody who had a friend or a cousin or a sister that had this happen. And that is the beauty of these smear campaigns, is that all you have to do is like the game of telephone. You release something to one person and it spreads and it spreads and it spreads. So if you send this message out to 2 or 3 people, those 2 or 3 people may have even been paid by you to spread this message. But if they tell their friend who tells their friend, then that becomes an organic transfer of a story. And as soon as you have that organic transferring, you have that spreading across multiple people. And our bodies And our brains are designed to memorize things that are threats. We're not designed to memorize happy things, things that make us feel good. We have an acute ability to hone in on the things that are threats for us. And so when we have a threat in a story of something that we heard, it's something that stays inside of us. We could have heard it when we were 15 years old. And at 60 years old, you still hang on to that idea because it's a terrifying one.
Oh, sure.
So that story is still something that is spread all the time. And the fact of the matter is that even if there was a connection between chiropractic and strokes, if you thought about this being a real fear for individuals, the amount of chiropractic adjustments done in Edmonton, where we are alone in a day, is in the hundreds of thousands.
Hundreds of thousands a day?
There are, I believe, in Alberta, let's go to Alberta because I know statistics of how many chiropractors are in Alberta.
Mm-hmm.
There's roughly, last time I checked with the registering body, there's around 1,700.
Okay.
So 1,700 chiropractors in Alberta.
Yep.
Let's say an average of 50 people a day those people see.
50, wow.
A busy clinic sees quite a bit more, and some starting people can see a lot less.
That makes
but
sense.
If you say 50 people in a day, 1,700 times 50, I'm not good at math, but that alone is an adjustment in a day.
Totally.
So you take that and you extrapolate that over a month, and then over a year, and then over 10 years. And you think about how many of these news stories that have even been released, and those news stories have been disproven. So if we were out there actually causing strokes in even make it 0.01% of all adjustments, you'd hear it. You'd hear news of it every single week, and it's just not happening. So when we know that there's such an intense microscope on us, and we know that the media is ready to just grab that story and run with it no matter what happens, then if we were making these fumbles the way that they say we are and we can do, then it would be everywhere. We would not have a profession anymore. So just looking at statistics, looking at numbers, looking at logic, we know that the risk here is substantially lower. And then the other side that we want to look at is chiropractic malpractice insurance. If you ask a medical doctor how much they pay a year in malpractice, it's substantially more, like tenfold. So if chiropractors were hurting people at the degree and the rate that they claim that we are,
insurance claims would be astronomical.
Of course, you can't fool insurance. If there's a place that they can make money and they know you're a risk, you can get one ticket when you're 16 years old and they'll still know about it. Totally. So there's a lot to show this. The problem is where and how does this information reach the public? And it doesn't. There's a lot of efforts to make it so that information does not reach the public. And there's also a lot of fear and stubbornness inside of individuals that have heard these stories, that their subconscious mind that wants to hold on to that theory of that threat, it's very difficult to convince somebody otherwise. So even if I told them to their face, it still takes me going through x-rays with individuals, sitting in my office for an hour, talking to them about all of the different things that we're going to do, why we're going to do it, why we need to do it. And, we're very good in my clinic, at least at gaining people's trust. And I get a lot of people that come to me that are scared to go to chiropractic, and they've sought me out specifically because they've heard that, I'll take the time with them and I'll talk with them. But, if I get 10 new patients in a week, at least 2 of them are going to be telling me that they're scared of being hurt and that they don't want to be there and that I'm their last hope and they've tried everything else.
Interesting.
So you have to learn the ability and the tools that are necessary to show people, not try and convince them through just, believe me because I said so, but actually show them why and how what we do is effective and necessary. And then the best thing for me in my career always is those people coming back on their second, third, fourth visits and just dancing into my office, because not only do they feel amazing, but things that they were told could never have help, people that are told for years and years and years by their medical doctors and their orthopedic surgeons to never let somebody touch their neck because it'll just make them paralyzed. And then they come in and for the first time in 10 years, they don't have a headache, and their life changes, their life opens up. And that to me is the miracle of what we do, but it's hard to reach the public when we're fighting all of this other stuff.
That makes sense.
Yeah.
You touched on x-rays. And
Yeah.
you touched on, because x-rays is an interesting thing that you won't get an x-ray from a massage therapist or a physio or an acupuncturist. So maybe talk about the education that goes around, or at least the first visit of me coming to a new clinic. What does that look like compared to if I were to go to physio or massage? So there's x-rays, you sit down, what is a consult, kind of go over that. And then as well as the benefits and types of customers you would see.
Okay. This also varies depending on what type of chiropractor you go to. You're going to get, if you have 100 chiropractors, you're probably going to get 100 slightly different first visit expectations or experiences.
Okay.
In my clinic specifically is all I can speak to. But when somebody comes to my office, the first thing that we do is a very thorough history. So when somebody has any sort of health related, whether it's an injury or it's a diagnosis of a condition that they have, history is your number one asset in figuring out what's caused that and how to fix it. So I take a very thorough history, and we take a lot of time going through that history, because people also don't realize many of the things that are actually important are important to me. So,
Okay.
When somebody comes to a chiropractor, having general understanding from the public, they're going to talk about probably my low back hurts and I hurt my knee one time playing basketball. And then, okay, that's a good starting point. So then we start there, and then what caused the low back pain? How long has it been an issue? Oh, I've had it for years and years and years. So then we go back, did you have any injuries, any motor vehicle accidents? And we start a process of basically going layer by layer through the individual's life and through each symptom that they have, and starting to shed the layers of time that have kind of blurred their perception as to how it started and what it meant.
Oh, okay.
So quite often we'll get down, a series 6, 7, 8 times. I'll ask the same question in a slightly different way. And finally I'll get the answer to that question. And, have you had any motor vehicle accidents? No, never. Any slips or falls? No, never. Did you play sports? Did you play hockey? Yeah, I played hockey. Did you get hit into the boards? Yeah, sometimes, but not that I can remember. And then you go through all of these things, and then, okay, what other things do you like to do for fun? Oh, yeah, I ride quads. Okay. Any injuries on the quad? Oh yeah, when I was 16, I flipped the quad. It landed on me. I was in the hospital for a week. And it takes this long of a process before you can strip down how to get to the actual source of these things. So then from there, when we find out, what this person's life looked like, then we have a guided response as to what our exam should be tailored to. So if somebody came in with lower back pain, but they told me they flipped their quad and it landed on them and their neck was really off and they got treated for whiplash and they're in the hospital for a week.
Yep.
I'm going to be looking at their neck too, because your body it's not isolated. You can't swap one part for another one and completely exist in categories. Your body is one unit. And when you have force into the body, we have to go back to the laws of physics. Force has to travel through the body and make its way out the other side. So if you think of the visualization of getting hit by lightning, wherever you get hit, it has to travel somewhere to reach the ground to degenerate or dispose into the ground.
Yep.
So same thing with force. If you fall you land on your elbow, you may chip your elbow when you landed on the ground, and this may be your main source of pain right now. And this is where if you go somewhere and say, my elbow hurts, they're going to look at that area, maybe take an x-ray of that area.
Sure.
But when you get to the whole story and you realize your whole body landed on that elbow, we know that that force transmitted across your body, all the way through your neck, all the way through the other side. And then we start to look at, maybe you're not feeling this today, but 3 months, 6 months, a year down the road, when all of a sudden you're just getting chronic headaches and you've never had headaches before, it's so far away that when you go into somebody's office and you ask about getting treatment for headaches, unless they take the time to strip those layers back, you'll never know that it came from the force that happened when you chipped your elbow.
Totally.
So our goal is to look at where these injuries could have affected, get a test done on those areas and all of the other areas that we think may have a relationship to that. And then from there, if there looks like something that we need to see a bit more in depth, then we're going to send for x-rays.
Okay.
The reason we send for x-rays, and like you said, massage, physio, I don't believe any of those other alternative categories. I may be wrong. I don't believe they have the ability to send for x-rays
I'm pretty
except
sure you're
for
correct.
physio. Physio does, I think, but maybe not. But they don't often. And the difference comes down to the training. When we're in chiropractic school, we are trained to read x-rays like a radiologist. So one other thing that happens often is people will come to my clinic and they'll have an x-ray report from somewhere that I don't have the ability to see online, and they'll give me the report. And to me, for myself at least, that report is not very helpful, because when it comes to x-rays, most of the things that I'm looking for on there, a radiologist isn't looking for, and they're not trained to see.
Really?
Correct. Yeah. So
Like what?
well, distortions in a vertebra. When we're looking for injury, we can see very quickly a change in things like there's a line at the very backs of the vertebra. When you draw it out, it's called George's line.
Okay.
And that line, if there's a break in that, tells us that we have a dismovement or a subluxation in the terms of chiropractic of a vertebra that's shifted out of its normal position, which will be leading to dysfunction. We're looking for pelvic tilt and orientation.
Yep.
We're looking for heights of iliums. We're looking for curvature in the neck. One big one we're looking for is the atlas and the upper spine. So is the occiput twisted on the skull? Is the very top bone, the atlas, shifted or rotated? These are things that a radiologist in the medical field has no training to look at. So when they see a neck, they can comment sometimes. If they're good, they'll comment on the curvature of the neck. Most of the time they won't. And you can have a neck that's completely tilted this way. They won't comment on head tilt. They won't comment on symmetry. They won't comment on skull position. They're going to comment on fractures, true dislocations, like completely out of joint.
I see.
Cancers, or curvatures. That's the only thing that they will assess.
Okay.
We're looking vertebra by vertebra at the position and function of each vertebra. Through that, when we see an x-ray, we can also tell with a general, scope of things, kind of like carbon dating, we can tell how old an injury is versus a new injury. So if a joint has been in a place or in an injured state for more than a few years, we're going to get a change of the actual physical bones connecting to that joint. So we'll see changes in shape. We'll see whitening around the perimeter of it, where that bone is going to be getting a bit more mineralized, a bit more dense. And this is the starting stages of osteoarthritis.
Interesting.
So all osteoarthritis is a joint that's been injured and dysfunctional that has not been restored over a long period of time. The degeneration is osteoarthritis.
Oh, okay.
This is something that is highly treatable and incredibly preventable, but in the medical world, it is a age-associated, natural, normal thing to happen. This is the difference in ways that we see the body, because we're looking at cause and effect. They're looking at naming. So if you can name something, if you can diagnose something, then you've done your job. But for them, there is no change and no ability to help osteoarthritis, because to them, it's a one-way street. It is an age-related decay. The difference and the problem with that story is that somebody can have osteoarthritis in one knee and not in the other knee. They're the exact same age. So what's the difference from knee to knee? The difference is that one of those knees has been dysfunctional for a long enough period of time to develop osteoarthritis.
Interesting.
As a chiropractor, our goal is to look at every joint that's dysfunctional and restore its function. So when we're looking at x-rays, we're looking at preventative, and we're also looking at how long has something been amiss and how much time is it going to take to actually start correcting that.
Okay.
Yeah.
Very interesting. Very interesting. I had no idea about the in-depth analysis of the x-ray. I know I would hear about it. Oh yeah, looking at this, but very interesting to know that there's such a vast difference in regards to the knowledge of what you guys look for versus what a radiologist does. Because in my Western brain, radiology is right up here at the top, right? For x-ray anyway, right? So, and then as I'm chatting more with chiropractors, one of the big things that they say is, because I ask, like, what is your specialty? What's the benefit? What's the big thing? And some chiros will say, we are experts at diagnosis, to really know what the problem is. And from the sounds of it, you guys spending so much time figuring out the history of things, you can really find the root cause of the problem rather than just treating the symptom.
Correct. Yeah.
Interesting.
The one, I guess, area where finding that root cause, the reason that it's maybe not as widely accepted from a chiropractic diagnosis versus a medical diagnosis is that the root cause most often at the end of our research and all of the investigation that we do is not going to be the root cause that is going to be brought up in a medical office.
Why is
So because it goes back to the philosophy and the understanding that a distortion of the nervous system creates dis-ease and then creates disease.
Oh, I see.
So if we find the root cause, it's going to be something that the medical doctor may not agree with or may not see in the same way. And therefore, their diagnosis is going to end at the diagnosis. As long as you can name a condition and you can provide a diagnosis, you can provide a medication or a round of treatment that is going to, quote unquote, help the symptoms of that. And that is going to be the end. So one of the reasons that there is not as much, I guess, cohesive working from field to field when it comes to medicine and chiropractic is that what we get to in terms of our diagnosis is usually very different. And it's tough to bridge that gap because our training is just very different. So at a certain point, we're speaking very different languages in terms of pathways of disease.
I totally agree with that because I have low back pain. Oh, it's because your back's hurt or whatever it is. Or it's because you have tight quads, which then pull the pelvis to anterior pelvic tilt. But you need to figure out how everything's connected first to understand that. I remember like when you and I were in personal training, right, and chatting with everyone's like, oh yeah, it's lower back pain, right? But until you know more information about how the body is connected and understand the position of the hips causes issues in other places, you would never know, or what muscles pull the hip into a position that would cause another issue somewhere else on the line.
Correct. Yeah. And this is, it's an old saying I use quite often, but if all you have is a hammer, everything looks like nails. And this is where your layer and your level of training is going to dictate your view that you're going to focus on. And so when we were discussing earlier in this interview about the differences, from osteopath or a physiotherapist and massage therapist doing manipulation to chiropractic, that is actually probably the best way to say it, is that our level of training gives us a lens to look at things differently than they do. Therefore, when we provide the thing that makes the noise, we're doing it for a very different reason and a different purpose than they are.
Interesting. That's good. So patient comes in, you figure out all the history, and then you got to figure out if you need x-rays or not. And then your x-rays come back and you just look at it even more depth analysis and understand, okay, that's the issue. So what would be the next kind of treatment? Because everyone just says, oh, I need to go to the chiro to get my neck cracked, right? So what would be the next thing you guys would do with a patient?
Well, once we've completed the analysis and once we have the information needed through x-ray, through palpation, through orthopedic exams, we have the whole picture. And at that point, what I develop for each individual is basically a blueprint. And from that blueprint, we have our checklist as to things to check on their subsequent visits and look at how those things are responding, reacting, and progressing. So the next step from there in that visit would be an adjustment. And that would be where we would lay them down on the table and we would, some adjustments are done seated, most are done laying down.
Oh yeah.
And we would go through those areas. And in every single one of those visits that they come back afterwards, we may address similar areas as we go, but that's because that is their individual signature. It's like a fingerprint. So your body has adapted to the stresses that have come through your body in your life, and it's created a very unique blueprint. That doesn't change. It changes only when we provide positive stress slowly. The body starts to adapt in a positive route. Or if there's a new large scale stress like an injury that then can change your blueprint. Outside of that, your body is going to stay that same signature as we work through it. So from there, we basically know, and this is why some people will talk about how short a chiropractic visit is afterwards.
5 minutes.
And you don't
minutes.
need much time. If I have your blueprint, all I have to do is recheck those areas and make sure that they're needing an adjustment. If an area is moving properly, there's no swelling, no change to, or no inflammation, the function is proper, the symmetry is proper, then we know that area is actually functioning okay. We leave it alone. we go to the next area. So there's a global scan that happens, but I like to look at when people are on the table as if a musician is reading sheet music. You can be a trained musician and never know a song before, and that music is put in front of you and you know exactly how to play and what to play.
Mm-hmm.
So when somebody lays down, the benefit to that is not only have we heard the song before, but we're the ones that wrote it based on what we saw in that first exam.
Okay.
So from there, we have the sheet music. We know what we're looking at, and very quickly we read the body, we assess the areas that need to be adjusted, we adjust those areas, and you can get on your way. So we don't need to do the other things.
Because a lot of people assume, not necessarily assume, but they link the length of the visit to the quality of the visit.
Correct.
So when someone says like, oh, my visit was half an hour. Oh, well, and my visit was 5 minutes. Well, it just sounds like you got ripped off if you're paying for the same amount of money.
Yeah. And this is, I think, one of the primary driving forces between chiropractic people or chiropractors that are starting to use other modalities that are more soft tissue related and more physiotherapy related is internally, those comments, they start to add up. And sometimes people start to feel self-conscious about what they're offering, and maybe they don't have the faith and the confidence in the adjustment that's actually worth the time and the money for the individual. Totally. So they start wanting to fill those visits with other things that take up time. So if you watch YouTube and you watch all of these TikToks, the number one rule when it comes to marketing when you're in the health field is provide a high amount of free content, so much so that those individuals start to trust you in a way that they want to come to you for the paid content.
Sure.
That is the rule across the board. So what does free content look like in the healing realm of things? It looks like stretches, and it looks like rolling, and it looks like things you can do at home. This is why there's been such an emphasis on you need to stretch. It's not necessarily because those stretches are actually going to fix it or that those stretches are actually helpful, but those stretches make it look like I'm giving you something you can do on your own. So sometimes stretches are necessary and sometimes rolling is helpful, but the vast majority of those things are given on Facebook, Instagram, TikTok as a way to look like an expert in that field.
Interesting.
Now, when that person comes to your office, that person is wanting more. That person is going to expect that you can do those things for them. So you start scraping, you start doing needling, you start doing stretching, all of these things that are not, for me as a chiropractor, they're not the high ticket item that we have to offer. The difference is that I believe in the chiropractic adjustment as the most important thing that somebody can get when they come to my office, nothing else. So if I spend my time filling up a half an hour just to say I filled it up, then I'm actually wasting time that I could be providing the best thing I can provide to a whole bunch of other people in the waiting room.
Interesting. Very interesting. I can see the application of the soft tissue stuff to be very important in regards to physiotherapy.
Correct, yeah.
Because you do need some time to allow the muscle to release, whatever the case may be, if they're working on soft tissue. That's why massage therapy is quite a long time, right?
Yeah.
But it's very interesting that if you can provide the highest value in chiropractic care with the adjustment, because that is the main reason, you don't need the time. You don't need to spend 5 minutes adjusting the same thing because you adjust it once and then it's adjusted.
Correct. And like we were talking about, it's high velocity. So it's milliseconds is all that's required for an adjustment. So, you know, if you provide 6, 7 adjustments, then all you're doing is getting the body settled, ready, waiting, ready to accept the adjustment, because you don't want to just go in there jamming at things. Right. But you can do that. If I have nothing to talk about and we don't want to talk about the weather and your symptoms have not changed in a way that I need to have an update, and you know we have nothing that is pressing, and you lay down on the table, if need be, I could complete your adjustment within a minute. And that is not me rushing you. That's not me providing less than I should have. That's me providing exactly what I should in the way that I should in the most efficient way. So when you're at a chiropractic office, my visits are still, you know, longer than a minute because I prefer just simply having a good relationship with people. But most of the stuff that is talked about when you come into my office, there's clinically relevant, and then there's how's your day? What's, you know, there's the simple things that go through a proper social interaction, and those things make a comfortable, disarmed environment for me, and that's why I hold value in them. But when it comes down to providing the service, you can't you can't look at the service time as the service value.
No, you cannot.
Yeah.
It's the outcome
Exactly
of what it is.
Yeah. And it's the education in the original session. This is another thing that I spend a lot of time doing with people that I think is something that is maybe lacking in certain parts of our field and others. But if you take the time in the first time that you're visiting them and you do a very thorough analysis and you do that very thorough x-ray reading and you explain to them everything that nobody's ever explained to them, then by the time they come on your next visits, they don't need to hear what you're thinking. You don't need to prove yourself to them anymore. They know that you know what you're doing, and they know that what you're doing is effective, and therefore that's what they're there for. You know, they're not there for the rest of it anymore because you've already provided that. And I think that's the most important part, is to be able to provide that enough that they trust you moving forward. And it doesn't have to be a consistent, you know, reproving to them every single visit why you're doing what you're doing. They get it. And that's, you know, and then you continue with your treatment.
And how long is a typical first session compared to the subsequent visits?
My first sessions are 45 minutes.
Okay.
And some don't take that long, depending on if the person is chatty or not. But I like to make sure that the first visit is never rushed, because to me, that is what builds all trust and all confidence.
It does.
So that first visit, I'll go through any of their previous medical history and previous medical imaging. So we can still go through a fair amount of x-rays on that first visit if they have previous x-rays in file. And then the follow-up visit is usually about 15 to 20 minutes where we're going through x-rays.
Okay.
And then from there on out, we book, you know, on 15-minute intervals, but we usually have 2 people per 15 minutes. And,
gotcha.
you know, 7.5 minutes inside of the office when we've already done the assessment. That's enough time. If we started a timer right now and we ended it 7.5 minutes from now, I think everyone would be quite surprised at how much time that actually was. So we can go through talking, we can get full updates on how they're feeling. We can even alter the program if need be from there and continue and get the adjustment in and sit down and have a debrief and reschedule without that 7 minutes ending up ran out of time. So there's a lot you can do in that time. But you know, it's efficiency, and it's making sure that their time isn't wasted, our time isn't wasted, and that we're all not feeling rushed, but we're also getting exactly what we need.
Very interesting. That's probably the best explanation that I've heard about the duration, because I've always assumed that longer is better, right? You have more time to spend the care, but realistically, if it takes milliseconds to do the adjustment, that's all the time you really need. Right. And if you're doing 7 and it's 1 second per adjustment, that's 7 seconds. And then maybe, 10 seconds between each to set up the next one. The time actually adds up very, very little.
Correct. Yeah.
Interesting. So maybe talk about now what types of patients would be coming to Chiro. And if I was injured, how would I determine that I should go to a chiropractor versus all these other modalities?
Yeah. So who should come to a chiropractor basically comes down to anybody that has a spine and a nervous system. And that may sound cliche and a little silly, but I've adjusted babies that are 2 days old, and I've adjusted somebody that's 101 years old. So everybody in between requires a check and a treatment sometime or another.
Okay.
Our bodies go through an exuberant amount of stress on a daily basis. From the day that we're born, the birth itself is an event that can put stress on the body.
Sure.
And we can have negative outcomes and negative repercussions due to certain things that are done throughout that birthing process, whether the baby gets stuck, whether there's forceps used, C-sections. We all want to pretend and think about the fact that birth, is glorious. And as long as the baby comes out healthy, then we're okay. And that is true in some way, but there's a lot of coming out healthy that we don't actually have an ability to assess. So when we get, newborn babies, we always want to check and assess their nervous system and make sure that everything is functioning and moving the way it should. This is preventative. From there on out, anytime, any year in your life, you can have an event that happens where, you fall off your bike, you fall doing a handstand in the gym, you do a clean and jerk and it lands on your head. All of these things are the trauma-based reasons that people would come to a chiropractor. Okay. This is the most common idea of chiropractic, is that you go to correct an injury.
Yep.
Now, this is absolutely true. If you ever have an injury, then if a car, for example, is in a motor vehicle accident, everything on that car is typically fixable unless the frame is bent.
Yep.
So that's how we usually dictate whether a car is written off or not.
Mhm.
As a person, we want to make sure that the frame is not bent. We want to make sure the frame is functioning properly, and therefore the nervous system is functioning properly, so that all systems of the body can properly communicate and function at their highest level. So if there's ever a time that something comes through your life and into your body that may have disrupted your nervous system or disrupted your actual physical structure,
Your frame.
you want to get that frame checked, assessed, and put back into its proper function. So any physical incident would be grounds and cause to go get checked. Now, judging whether you should come to a chiropractor or a physio or any of these other things after an incident, the simple answer to me is that we want to check the frame regardless. If we straighten your frame out and get that working properly, we still may need a new headlight. We still need to buffer
Yep.
out the paint. There's other areas that still need treatment and still can benefit from treatment, but without doing the initial treatment of the frame and of your central axis, we're leaving ourselves up to a place that the outside, the exterior itself may not be functioning at its best and may not heal at its best. So if you're going to do all of these things, go for it. But at the very least, go get checked and assessed by a chiropractor. Outside of physical trauma, we have every other reason to look at the body as an organic structure. The organic structure is always changing. And the rule of organics is that organic structures change based on stress placed upon them.
Okay.
All stress is going to affect you positively or negatively. There's no such thing as absolutely neutral stress. So if you have stress in your life for got in a fight with your spouse, maybe your job sucks right now, maybe you lost your job. All of these things are high stress responses.
Sure.
Stress responses lead to inflammatory responses, lead to change in regulation of your sympathetic nervous system. All of these things can be directly addressed through chiropractic adjustments. A chiropractic adjustment stimulates the vagus nerve, changes the balance of the parasympathetic versus the sympathetic. So it comes down to, again, regulating your nervous system when any stress is brought into your life. This is something that is used as a rehabilitation or it's used preventative. So if you're in a great place right now and you have no stress and everything is amazing, this is also an awesome time to get checked and addressed by a chiropractor, because when you're at your highest and you're having no symptoms, we can still go in and assess the body and see the areas that are potentially at risk of allowing that glorious time that you're in to start to slip. Because everybody's going to have previous injuries. Everyone's going to have weak points. Everyone's going to have something that affected their body that is laying dormant because right now the body's doing a good job adapting to it. But eventually it will stop being able to adapt to that. And this is why we see a lot of people coming to the office, mostly in their 30s and 40s, because we have a lot of injuries and incidences when we are young that aren't addressed when we're bouncy and we think that they just disappear into the ether.
Yep.
Then we start aging a little bit, and then we start having sedentary lifestyles, and all of a sudden these weak links start to expose their weaknesses. So getting adjusted and getting checked in the chiropractic realm, it's thought of as a lifestyle. It's a wellness technique to be able to manage and maintain health across all aspects of your life. So whether you're hurt or whether you're in the best place you've ever been, whether young, whether old, getting checked and addressed is like doing preventative nutritional counseling. It's making sure that you're putting the right things in your body and making the right stress response in your body so that long-term your global function can stay higher longer.
Interesting. Very interesting. So if I'm feeling the best I've ever felt and I go to a chiropractor, what could be the outcome of that visit? Could it be that there's zero adjustments needed? Or will there always be something that needs to be done? Because if I feel like, okay, well, in my head, chiro is adjustment. It is not manipulation. It's adjustment of the spinal column, right? And the nervous system, whatever it is. And then I say, yeah, everything feels great. And check, yeah, everything is good. And then I walk out. Would that be an expectation that could happen? Or will there always be something that could be adjusted?
Well, think about it this way. You're in incredibly good shape right now.
Ah, thank you, bro.
Okay. Can you always be in better shape?
Of course.
Of course. Is there anybody in the world that you think is in such good shape that they would walk into your gym right now, look at all the weights and think, don't God do nothing today. I'm going home. Other than a rest day, other than listening to their body and thinking, okay, today's a day I need to take off and recover. Is there ever something that you can do to continue to not only improve, but also maintain what you've got?
There always is.
Always. So the idea that you can be checked, and there are chiropractors that you'll go into their office and they'll say, you're clear today. There's nothing we have to address. And there's nothing that I have against them. The difference is that chiropractor is trained in a very specific type of adjustment, which means that they adjust one single area on the body. And so many times when somebody comes into my office, I have their global blueprint and say I have 5 things that I have listed are injury areas that are needing check and adjusting.
Okay.
Quite often, I'll adjust 2 of those things. I'll adjust 3 of those things. I'll adjust 5 of those things. It'll change from visit to visit based on which area is holding the adjustment from last time. The individuals that you'll come in and you'll get a full clear, it's because they look at one area and one area only, which is very highly reputable. I'm very much for these styles of practice because they're very effective at what they do. But it's a lot easier to say one area is holding that adjustment and therefore you need no adjustment because that's the only adjustment I provide, and you can be clear. Outside of that, any other type of natural healing, there's always something that you can do to improve. So you can never eat too healthy that the next meal doesn't need to be healthy. You know, you can never work out enough that you never have to work out again. You can never go to a massage therapist and not feel 1 or 2 muscles that are at least tight and need some working and some stripping. So when it comes to natural healing, we're always looking at the scale of positive stress to negative stress. So globally in life, we have a lot of things that consistently add to the negative side of that scale, whether it's sleeping on not a great bed, being a little stressed out, maybe I had to eat Tim Hortons today because I was in a rush. All of these things, the organic matter tends to move towards decay. That's just the laws of physics. Okay. So when the organic matter is not provided with a positive stimulus to keep it in its shape and in its function, it will always start to decay. So we're dealing with a constant decay that we have to constantly put something on the other side of that scale. So those treatments and those adjustments, even if you're feeling fantastic, you're not on a platform that doesn't move. That scale is still slowly tipping over time. So our goal is to consistently add positive stress to make it so that you stay in a neutral or at least moving the other direction if we can add enough positive stress where you're even better than you were.
Interesting. That's a good explanation because it's true. There's never a point where you're optimal. There's always something. Even if you're training like crazy, because the volume is there, one muscle may overcompensate. You may not feel it right now, but it's there. Interesting. So then from that, you feel that chiropractic care should be done on a consistent basis.
Correct. Yeah. Yeah. The best way to do anything for global long-term health is consistently and strategically. So with your adjusting, if we didn't ever have to worry about money or money was not a concern and you had access to a chiropractor, I would recommend weekly adjustments for pretty much everybody.
Really? Weekly?
Weekly.
Oh, wow.
I get adjusted every single week, every Friday. And everybody has a different sweet spot. But most of the time, if you talk to anybody that utilizes chiropractic or understands, has been adjusted before and used it, the only thing that makes it so that they're not adjusted more consistently comes down to money and time.
Sure.
So it goes back to eating healthy, to, working out, all of those habits are most effective when consistently done and done no matter what, when you're feeling good or you're feeling not good. So this is where the chiropractic is important to maintain a consistent schedule because those adjustments need to be made and are effective regardless if you're having the best day or the worst day. And when you go to the gym, we all know that mental fortitude is number one when it comes to getting progress. So some days you walk in there, 80 pounds feels like the lightest thing you've ever picked up. You're so happy, you're so stoked, best days, sun shining. Next day you go in, 80 pounds feels so heavy. It's rainy, you just had a fight, you didn't eat properly that morning. You still have to do the work. And that's the way that you get to success, and that's the way you obtain results. Same thing with chiropractic. If you're using it specifically and only at times where you are dealing with something that we are recovering, then you never get a chance to experience the actual benefits of being at neutral and having wellness care.
Okay. So it is important to maintain it. And just as you said, like, you always want to consistently do the best things for the body, eat well, exercise, sleep well. But even just thinking about it, like, long weekend, someone goes camping, they sleep on a crappy bed or a mattress in the tent, or they're gardening and they're crouched over a little too long in the day and they have a little bit of a backache, but it doesn't feel terrible. So they don't have the alert of like, oh crap, I heard it. I should go get it checked. But those small stresses throughout the week would slowly build up. And your philosophy is, as you go to visit a chiropractor weekly or whatever it is, that we can begin to shift that scale back to neutral or positive.
Correct. Yeah. What chiropractic does is the secret power of chiropractic is it's basically like sending homing devices in your own body to recheck up on areas that maybe are dormant and your brain isn't looking at.
Okay.
So every time we adjust you, we create a movement to that area. That movement stimulates the nerves that are associated with that muscle and with those spinal segments, and those shoot up to the brain. So a doctor named Dr. Heidi Havoc has done a lot of analysis on the neurological components of an adjustment, but every time we make an adjustment, we make an instantaneous connection to the prefrontal cortex of the brain. So we have this shooting up to the brain and basically telling the brain, right here, I want you to look, I want you to check. Right here, I want you to look, I want you to check. This trains your body and your nervous system to start adapting quicker to new stresses in the body. So globally, when you're getting adjusted consistently, you're consistently teaching your body to address areas of the body that you would never have addressed otherwise, and get the body to consistently be checked in on in all of those areas. You're also training your nervous system and the surrounding soft tissue in the areas we're adjusting to much more quickly adapt to stress when it comes to the area. So one of the benefits of consistent chiropractic care is that your body starts to have the ability to shake out from these things back to its original position by itself better. So in between those visits, those little stresses that sometimes could be the thing that threw your back out and you're out for a week, now your body is used to what the back feels like when it's out, but it's also used to what the back feels like when it's in. And those surrounding muscles and ligaments around that joint are no longer weak and lax and not used to being stimulated. So they can take that stress, get that stimulation, pull itself back into the right position, and on you go.
Interesting.
Through time, you start adding those things up and your body starts to become a lot more resilient to stress and change.
Wow. And is that only surrounding an adjustment? Or say if I did self-massage, am I training the body in that similar way? Or is it only surrounding if I do an adjustment of the spinal column?
Well, all stimulation to the body for any sort of stress response or any sort of physical response that causes inflammation or sensation will create some body awareness and body ability to adapt. The difference with the chiropractic adjustment is the stimulation to the nerves that was shown in Dr. Heidi Havoc's work.
Oh, I see.
There has to be a specific amount of speed, that high velocity, low amplitude speed, to the segment of the spine to create the same response with the prefrontal cortex. So
me just touching and poking, not going to do
not the same. It's still, it's still going to provide some benefit.
Yeah.
And this is where KT tape has become such a big thing in the field.
Yes, K-tape. Yep.
K-tape is, there's a lot of mystery around how and why it works because it provides absolutely zero support.
It's true.
But what KT tape does is that you put it on the skin and it stimulates the epithelial cells and consistently allows just enough of a sensation there that the body's checking in on that area much more consistently. This allows the muscles around that area to stay stimulated when they would probably go dormant doing things that they're not needing to be highly stressed in. This allows the body to stay more stable. So all levels of manual therapy are all helpful, and they're all going to have their benefits in many different areas. The chiropractic adjustment is a higher speed, higher amplitude, so it actually creates a significantly larger stimulus to the brain. And then it also breaks up the scar tissue around joints, and joints are by nature afferent. So they they have signal cells, they have nerves all the way around them that send signals to the brain all the time.
Okay.
And so your brain on a daily basis, they estimate that 70% of all of the stimulation your brain gets in a day is signals from the spinal nerves.
Oh, wow.
So when you're getting these spinal segments moving, you're getting high levels of integration of information to the brain. So the chiropractic adjustment, going back to, again, providing the highest level and the highest bang for the buck of a treatment when somebody comes to my office versus other modalities, that adjustment is like a nuclear bomb of positive afferent information to the brain, and it allows more change to the nervous system and more change to the affected tissue than any other style of treatment around that area. So that's going to be the big difference between the speed of the adjustment and also the amount of force that goes into the adjustment. It's still quite gentle, but it's a lot different than just, if you're pushing on somebody's back like this nice and slowly,
right,
you're creating a little bit of a push. But if you have a very quick, direct adjustment, you're creating a very high stimulus response in the body.
Gotcha. And could you achieve that kind of velocity and outcome doing it yourself? Because I just cracked my neck right there. So is that similar?
Yeah, no, not at all.
Okay.
So the difference is that when you're cracking your own bones, to adjust an area, by definition, a joint that we're adjusting is a fixated joint. So a subluxated joint is what we call an area that we're going to adjust. It's called a subluxation in chiropractic. Okay. This is an accumulation of a bunch of different, symptoms that show us that joint has become locked and stuck in its place. When a joint is stuck, you have to provide a force from outside of the system to interrupt that force and break that joint up. So when we go back to physics one more time, an enclosed system is what we are. An enclosed system, no force can come from outside of that system. All force is within that system already. Okay. So no new energy can be created. So when I go to adjust myself, if I move my neck and I get cracks, what's actually happening is the joint that's stuck is stuck, and it's telling us it's stuck, which is why we have the need to move our head and try and get it released. But it's not going to be able to move. What's going to be able to move is the joints above and below it that have adapted to having hypermobility because of that long-standing fixation. So when we go to adjust that joint, we can't do it ourselves, even as trained chiropractors, because we have to simultaneously put a very high speed contraction of our muscles. And at the exact same time as doing that, all of our muscles have to be relaxed, which is physically impossible. So if you think about Bruce Lee doing a 1-inch punch, that's very much the same process of developing speed for a chiropractic adjustment. Bruce Lee could not do a 1-inch punch while simultaneously being 100% relaxed.
Gotcha.
So when we hear the cracks and the pops in our own body, though they may feel good at the moment, they're simply just moving joints that are already hypermobile. They're not doing what we need it to do.
Gotcha. Yeah. Because 7 cervical
Columns?
columns?
7 cervical vertebrae. Yeah.
Yeah. So if I'm cracking, moving around, and C4 or C5 is stuck, I'm not applying enough force to get that guy to move. I may be moving 1 and 2 and 6 and 7.
Yeah.
But you're just saying I just physically can't crank it enough to have that amount of force applied to allow that joint to move.
Correct. And the way that you're applying force, when you're moving your head side to side, you're actually not applying force. You're doing a global large-scale motion, which is much more similar to the idea of a manipulation through other modalities. Is there's global large-scale motions where their goal is to get that release sound.
Thing to move,
So for chiropractors, truthfully, the sound is not relevant to us. It's something that, it can give us proof that the joint moved the way we need it to move when we feel it in the right place under our fingers.
Yep.
But sound or no sound is not of our concern.
Okay.
The adjustment itself, you have all of the setup, you have side posture, you have different positions. The adjustment itself comes down to the point of contact on either our hand or our fingers in that person's neck. So if we're adjusting the neck, for example, my fingers are right on that vertebral segment. So we have all of this motion, but it's a straight motion directly through the joint. You cannot provide that motion through a joint just with a global motion of your neck.
That makes sense. Because I'm not applying the force on one spot.
No, exactly.
It's just whatever it is, something moved, something cracked, good to go. But if I'm trying to move one specific segment on one specific vertebrae, you need the force applied essentially with a finger.
Exactly. Yeah. Pinpoint.
Gotcha. Okay. So all this means nothing to me except for the enjoyment of hearing me crack.
Yes. You get a little bit of dopamine, a little bit of endorphins, but
Yep.
yes.
Interesting. Okay. That's good. What about in regards to cost? How much does it cost to see a chiro?
Every clinic's different. And this again comes down to a lot based on the practitioner's belief system and what they value themselves at. So, you can go to a chiropractor that is priced at $25 a session, upwards of $80, $90 a session. Okay. So the difference comes down to how that chiropractor perceives their level of expertise, how they perceive the quality of care that they're providing, and I guess how much they believe in what they're providing.
I see.
So I'm on a higher end of that spectrum because I'm very clear in what I believe and I know the value of what I'm doing. But you see advertisements all the time for, come to our office, $30 deal for your initial consultation, x-rays, follow-up visit, and first adjustment.
Oh, I see.
That's great. It's a great marketing tool for clinics that
to get people in.
That really want to drive new traffic. And there's nothing against that. I hold a different belief system, very similar to the ideas of Apple, where you don't discount your products if you know you're providing a good product. So cost is very much up to the clinic. And this is an area that unfortunately many people use as the deciding factor when they're finding a chiropractic clinic.
Sure.
It's who's the closest to my house and who costs the least.
Yep.
And if that's the way you want to choose something that is so powerful and so valuable, then that's great. That is how you choose to do that. Most of the time, I would recommend for people to look at things like Google reviews, look at their online presence, watch them in their videos, talk to them, call the clinics. If anybody's ever concerned or anybody has questions, I always take time to answer phone calls, and I can chat with people for 20 minutes sometimes before they even book an appointment, just to clear through some of their initial concerns. Totally. So again, back to the old, your vibe attracts your tribe. Just find somebody that you are, I guess, connected to and that you have some sort of draw to. And then what they cost truly shouldn't matter unless there's some sort of strange outlier that would go way outside of what the norm in the field is. The cost, though there is variation, it's all within a general range, very much like buying a gym membership. It's
all within the same,
all within the similar range. Some are a bit pricier, some aren't, but in the end, you got to buy a gym membership based on the gym you want to train at.
Right.
Yeah.
Yeah. So understanding the whole practice is more important than looking at the price and the proximity to where you are. And also, like, if you're not going there very often, proximity shouldn't matter. So yeah, really obviously spend the time to learn about their business, learn about the doctor who's going to provide the care, look at reviews, look at past history, look at podcasts, listen to them talk.
Yeah, exactly.
There you go.
Yeah. If you're not somewhere that you feel comfortable and you don't resonate with that person, then all of the care moving forward is going to be strained and you won't get the results you're looking for. So
totally
take your time, do your due diligence.
That makes sense. Any closing remarks in regards to chiropractic care that you want some people to hear about?
Only that it's more powerful than many think it could be. And it's something that has changed millions of people's lives. And it's an incredible profession from ground up. So whoever you choose to provide your chiropractic care, understand that everybody is a little bit different. And if you find somebody that you love, follow them to the ends of the earth, because you're never going to find someone like that. On the other side of things, if you find somebody that you didn't enjoy the experience, go to the next one. Don't just not ever go to a chiropractor again, because we are all very different. We all have very different slants, and that is our strength. And that's what's created such a robust profession that's allowed it to become the third leading profession in the entire world in healthcare.
Really? Third?
Yeah. Damn. There's allopathic, mainstream medicine, dentistry, and then chiropractic.
Wow.
So we've grown a lot over the last 100 years. So there is, like I said earlier, 1,700 chiropractors in Alberta. So if you go somewhere that you weren't happy with, go somewhere else, and I'm sure you'll have a better or a different experience. But at the very least, try it, keep trying it, and do some research. Not not just the first thing that comes up on Google, but look into why chiropractic has grown this much despite so many people invested in us not growing.
Oh, sure. Yeah. And you bring up a good point in regards to not everyone is the same. And a lot of people assume it is the same, right? From physio to massage to chiro, whenever it's a service-based industry, personal training as well. If it's a service-based industry, it's going to be the person who's going to administer that service. If they're good or if they're not good, that doesn't mean that the whole practice is not good.
Absolutely. And it's very understood in almost every other area of things. But with chiropractic, that is one of those things that is maintained in the subconscious of most people, is that we are all the same. Every clinic will look, feel, be exactly the same. And every treatment's going to be the same. So it is different. There are many differences. There's many different techniques. So again, if you have questions and you're not sure if this person or this place that you're looking at is the right fit, call them, talk to the receptionist, talk to the doctor themselves. If they're not willing to talk with you, or you call them and right away the receptionist is quite rude or dismissive or whatever it is to your concerns, you're probably going to get your answer pretty quick.
Totally.
So take your time and look into why we've become what we are and how we could potentially help you.
Yep. Very good.
Awesome.
That's it, man. Yeah. Thanks very much.
Yeah. I appreciate you having me, man.
Good
Looking
stuff.
forward to the next one.
Yeah, bro.
Take care.
Done.